measuring intake and output, emptying that catheter at the same time. The big thing to remember is with your catheter care that usually it goes right along with peri-care. So if you get a slip, it may say do peri-care and cath care, or it may say like just do cath care, depending on what we put together. So just remember, if you get and it says just do cath care, make sure you verbalize that you'd already done peri-care. So I'll show you on a guy real quick, and then we'll do our gal. So we're gonna do beginning actions, identifying and introducing ourselves, explaining what we're gonna do. And we're gonna do our hand hygiene and get our gloves on. Bring that bed up to a good height for you. Okay, and I'm gonna pretend I have my water. I'm gonna pretend this is my no rinse body wash so that I don't have to have a rinse tub. And I'm gonna put this rail down. And I'm going to uncover my guy, keeping covered as much as possible. So this is a stat lock. That's that catheter securing device so that if it gets pulled on here, it doesn't get pulled on there and pull it out. So we're just gonna undo this. That way we can get to that catheter better. And we'll say I've already done the peri-care part. So I'm gonna get my washcloth. I'm gonna go ahead and stick this in. Oh, he's got one. We're good. Always make sure you have your blue pad ready. Okay, so I'm gonna get my washcloth and wring it out. And you guys hold it however you like. I kind of like doing the 4 flap thing so that it's easy to get to my sections. And the first thing I'm gonna do is I'm just gonna clean again right around that meatus. And make sure I clean right around it carefully. And then I'm gonna hold on right where I clean, get a new section of my cloth, and I'm gonna grab that catheter and just kind of clean down it. Back and forth, scrub it off, get another section, hold on again, just so we don't tug it out. Back and forth, and I do that 3 times or so, or as much as I need to get it good and clean. And I just clean it all the way down, and then I would get another one, or a towel, and dry them off, or rinse if I needed to. So then I'm just gonna finish drying off. So when that's all done, I'm going to put this back in the holder, and you guys will see there's kind of a smaller side and a bigger side to it. Your smaller side just goes right in there, so it just fits right in there like that. And then that just snaps back on there. So he's got some mobility, and this isn't gonna get tugged on here. The other things that we want you guys to be able to talk about is how to position that catheter. See, right now, we've got it looped, and that's kind of what we want it to look like. Over the leg, so that they're not laying on it and getting pressure sores or kinking it off. And then if we can loop it on the bed, that helps it drain better. Because if we don't loop it, and it just hangs down beside the bed, then we get that dependent loop, and that urine can just sit there, and there's that small chance that it could backflow and get back into the bladder. So we're gonna curl it, if we can, on the bedside. And hopefully they still have these on there. And you just clip that onto your sheet, and it'll kind of help it hold that curl on the bed. And then always make sure your bag is below the level of his bladder and on a part of the bed that doesn't move. Kind of like when we talked about restraints, you know, and not tying to the bed rail. We're gonna find one of those loops or holes, and that's where we're gonna put our catheter bag. Okay? So now I'm gonna say, okay, I'm all done cleaning you up. I'm gonna get you covered back up. And I'm going to put a blue pad on the floor because Kelly is good at making messes. And we're gonna empty his catheter and see how much urine output he had. Right now, we're just gonna empty a little bit out of it and measure it. If you get it for checkoffs and we say, you know, empty the catheter and measure output for the shift, you're gonna empty it all for us. So I've got my pad there. I've got my graduate cylinder and alcohol pads. Now the alcohol pads for cleaning, it is listed on the checklist as optional. Some people will clean that spout off before, some before and after, okay? I usually always, for me, clean it off after. That way I get that urine off that spout before I put it back up in the holder. So I'm gonna get that ready. so that I have that. So I'm just gonna come over here. This just pulls down and out. And I'm gonna hold it over my container. And to open it, I just push it to the left. We're gonna drain a little urine. Push it back over to the right to close it. And then we're gonna clean this off. Get that excess urine off of it. And put it back up in there. Then you need to take this to a flat surface. Get that out of the way. Because you need that on a flat surface so you can look and see how much I got. So we're gonna say I am, of course, right in the middle. So we're at about 420, we're between 425 and 450. So we'd say right around 435. 135. Thank you. Wow. So any questions? I confused myself. Any questions on and taken out? But see how it's right between the 125 and the 150? Mm-hmm. So you just get on a flat surface, that way you measure it accurately, because if you hold it up like this and you have it tilted one direction or the other, you can be off on your urine measurement. So always get it on a flat surface. So then what you guys are gonna do then is just split up and you'll practice that, but I'll show you female real quick on that catheter here. So we're gonna reset all of this and pretend I didn't just use it. And we're gonna come over and look at this gal real quick. So, same thing, beginning actions, hand hygiene, get your gloves on. We're gonna undo her stat lock, get her loose, get our first washcloth, soapy water. So with her, I finished up my peri-care, and I'm going to do the same thing. I'm gonna open up here, and I'm going to clean right around that meatus again, okay? If I'm doing just her catheter care. So then I'm going to get a different section of that washcloth, and I'm gonna hold on where I just cleaned and just do the same exact thing like I did with my guy. New section, and clean down 3 times. Get it good and clean, and then position it just like I did over there. We're going to put this back in here, and then we're gonna curl it on the bed, and she's not curled, so. Does she even have a clip?
No, not a clip.
So if we can't, we just put it on there and try, and hopefully it'll stay. You can use rubber bands sometimes will help. You can loop one around, but she might stay looped right there like that. Make sure it's hanging below the level of the bladder and on a part of that bed that's not gonna move. All right, any questions so far? All right, so we'll go ahead and stop that.